begin with new fears of a global pandemic. The historic Ebola outbreak in West Africa continues to spread this morning. Sierra Leone and Liberia are declaring public health emergencies. They're pleading for help in getting the virus under control. So far, as many as 729 people are believed dead, including one American.
It is the largest Ebola outbreak ever, spreading across 4 countries. Aid organizations are telling their workers to leave the region. Debora Patta is in Johannesburg with the growing concern over the virus with no cure. Deborah, good morning.
Good morning. The president of Liberia, with over 320 known Ebola cases there, has issued emergency procedures, putting the country in virtual lockdown. And a top Liberian health official sounded a warning, telling CBS this morning that controlling the epidemic is beyond his country's capabilities.
Ebola treatment centers in Liberia have been overrun by the sick and the dying. In a desperate effort to contain the virus, the government has shut down schools and closed many borders. Talbot Nyeswa is an assistant minister of health.
Our government has declared this now as a humanitarian crisis that is above the control of the national government.
Nyeswa appealed for more international aid, specifically medical staff experienced in treating Ebola.
This virus, if it is not taken care of, could be a global pandemic.
The disease is often fatal, with some people not showing symptoms for up to 3 weeks after infection. One victim was American Patrick Sawyer, who was working in Liberia and became violently ill during a flight to Nigeria. His wife said he was planning on returning to Minnesota in August.
He got it from his sister, who also died from Ebola weeks earlier. Without them knowing that she had Ebola.
2 American aid workers who were infected, Dr. Kent Brantley and Nancy Wrightball, showed slight improvement. Their charity, Samaritan's Purse, is now evacuating all non-essential personnel. The Peace Corps is also pulling out 340 of its volunteers from the region after 2 of them may have been exposed. U.S. health officials say the crisis is far from under control.
Now, this is not just a Liberian problem. The disease is spreading in Guinea and Sierra Leone, and public health officials and border control officials are on high alert across this continent, bracing themselves for the possible arrival of people from other African states who may be carrying the deadly Ebola virus. Charlie.
Deborah, thanks. Our chief medical correspondent, Dr. John LaPuca, is with us to examine the threat posed by the virus. Good morning.
Good morning.
We want to have more about this, but tell us, how concerned is CDC that it will spread to the United States?
I spoke to Dr. Monroe yesterday, who's really an important person with this. He knows a lot about Ebola and other infectious diseases. He said, look, theoretically, it could come over here. Somebody could be incubating it, come over here, and it could become in the United States. However, this is not Africa. In America, we have very sophisticated modern infectious disease controls. There was an alert sent out to all healthcare workers around the United States a few days ago saying, be on the alert if somebody comes in with flu-like symptoms, think Ebola. So hopefully it's early identified and the person can be isolated, they track down their contacts, and it's much less of a situation of danger here than it is in Africa. In Africa, it's a totally different situation. I'm really quite concerned about it, that maybe we're starting to reach the tipping point in Africa where it's going to be harder and harder to get it under control.
Contain it.
Yes, absolutely.
And you have pointed out this incubation period and the concerns that people could be on a plane to the United States, have Ebola, and not even know about it.
Right.
But isn't it important to point out Ebola is not spread like the flu? It is spread through bodily fluids.
Yeah, I'm glad you're bringing this up because I'm feeling right now a real sense of panic starting to be around people in the United States. This is not spread through the air. It is spread through direct contact with body fluids. Yeah. It's hard to get it from person to person.
So you're not going to get it by sitting next to someone on a plane who has Ebola.
You are not going to get it that way. But in Africa, the problem is they don't trust the doctors. They're running away from the doctors. They're running away from the health clinics. And they don't have the same kind of infectious control procedures that we have here.
All right, Dr. LaPuca, thank you so much.